Hello, everyone, and welcome to this episode of Thought Leadership in Aging Services and Technology. My name is Majd-Alwan. I'm the founder and CEO of Alwan AI Vantage, which focuses on advancing technology and innovation strategies, as well as adoption and growth, particularly in the aging services sector. Today, it's my pleasure to host Todd Burch, who is the founder and chairman of PrognostiCare. So welcome, Todd, and thank you for taking time to be here with us on this episode.
Thank you, Dr. Alwan. Appreciate you having me on. Looking forward to chatting with your audience today.
Excellent. Thank you. So today, Todd and I will be discussing an important topic for aging services providers, which is retention of staff. As we all know, aging service provider organizations are suffering from high turnover rates, as well as shortage of professional caregivers, and competing for caregivers with not only acute care, but also the broader hospitality industry. So again, we will be talking about an innovative solution that PrognostiCare has brought to the healthcare sector, and that would be very beneficial for aging service providers to learn about. So let's start by you, Todd, sharing a little bit of background information about yourself, PrognostiCare, and your role specifically there.
Yeah, absolutely. So I spent the first 2 decades of my career running hospitals and post-acute provider organizations across the middle part of the country, from Texas, Kansas, Iowa, Wisconsin, Michigan, and full spectrum of care services that I was able to lead. So I've got I think a good perspective on what's happening across the full care continuum. And so a few years back, when we founded PrognostiCare, one of the things that we were really thinking of is, what about retention? And this started with nurses, Doc. Nurses in healthcare are just absolutely critical to the work that we do. And so that's where we started the conversation, is how can we be sure that we are recruiting and retaining the right nurses? And as we got through it, we quickly realized that the solution worked for just so much more than that, right? It wasn't just for nurses. The way that we were tracking the information and getting the data really worked for anyone, not only in healthcare, but across any industry. And I think that's really kind of the power of the tool, is we're not getting any information from inside of the provider system. What we're getting is from public sources of data to be able to paint a holistic picture of what's the right person to join the organization, and then what's the right person that's most likely going to stay with the organization.
So you're looking at essentially the cultural fit based on public data from social media and so on and so forth, to see who is the best fit for the culture of the organization, essentially. Is that accurate enough?
Yeah, that's a pretty good high level description. So we've got social media, certainly one of the sources of data, but we have 21 different sources of data that we're currently farming, and thousands of different data points to paint a picture of the individual. And what we're doing is comparing that to who has been successful in that job at that organization historically. So at a job class level, who's the right fit? And being able to find the people and the personalities that are the best fit. You can't always get a perfect fit, but who's the best fit out of the candidates that are available at that particular moment.
Excellent. And I assume that may also include some of the characteristics and maybe even the traits of the supervisor, because again, there's a common saying that people do not quit jobs, they quit supervisors, they quit bosses. Is that part of it?
Yeah, the data has just been so fascinating, because I've made that statement myself, and it is true, right? If you have a bad boss, you're certainly going to be more apt to leave them. But what we do is we put it together at both an individual basis and a department, division, and if it's multi-facility, then facility basis as well. As you talk about people leaving bosses, one thing I used to say whenever I was talking to all of my managers, directors, supervisors, vice presidents is we've never hired somebody and said, wow, this person's a loser and we're gonna be ready to fire them in 6 months from now, right? Because you inwardly think we're the problem, and in some cases we are the problem. But interestingly, what the data is showing us is not that people are losers, but what it's showing is that they're not necessarily a good fit for the job that they've selected. Maybe they selected it because they just needed a paycheck. Maybe it was a matter of convenience. Could be a number of different issues. But what we're seeing is there are, in fact, the data is telling us a number of people that join an organization that are just not a good fit for the beginning. Whether they made a bad choice selecting that job, that organization, whether the manager made a bad decision hiring that person, a lot of different things go into it. But there are some people that are predisposed when they come into the organization that they're just not going to be good long-term fits, and in some cases not even good short-term fits. I mean, the 90-day turnover is just astronomical. I mean, you don't have time to know whether you love it or hate it in 90 days, right?
Exactly. Even the first 30 days, in some cases. You're absolutely right. So that's fascinating. So what else? What are other major trends that you are seeing in the sector in general, or from the data?
Well, healthcare across the board is under financial pressure, and there's always a fight for resources. And I think what everybody hopefully is taking away from what's going on the last several years is there's really not any more money coming into the system, right? There's lots of dollars in both the acute, post-acute, whole 9 yards. There's a lot of money in the sector. What we're not really good at is being efficient with the dollars that we have. And there was a Harvard Business Review study done, or published in Harvard Business Review. A study was done several years ago, and it talked about for every 10% of turnover that an organization experiences, you're going to experience a 5 to 8% decrease in productivity. And so when you've got average turnover, let's say it's 30% in an organization, which some departments that'd be a low number, right? So we got 30% turnover. We're experiencing somewhere between a 15 and a 24% decrease in productivity. And that's just massive, right? When in India, any of the care spectrum, a continuity of the staff that are competent at the job is critical, and it makes a difference in margin, a substantial difference in margin. So, I've got a friend that runs a very large health system, and their turnover is 13%. Well, their margin is almost 10%. There's a reason for that, right? There's a correlation between a low turnover and a strong margin. Conversely, the higher your turnover, the lower your margin is going to be. And so while it doesn't explicitly show up in the financial statement, it is absolutely impacting the income statement and the balance sheet on a monthly basis. It's not there, but it should be written in there that turnover is a silent killer of the margins and of the ability of the organization to continue to function and take care of the patients that are entrusted to it.
Absolutely, because there is hard cost in recruiting, advertising, time spent by the HR system reviewing, and the managers, right, reviewing resumes and interviewing people, and then onboarding, incentives in some cases, right? So there is hard cost that is somewhat hidden related to turnover and hiring. So what are some of the innovative approaches that you observed, adopted, or have seen, and what are some of the impacts that you've seen?
Yeah, so there's all sorts of things going on in HR and labor tech right now. A lot of interesting tools. The PrognostiCare tool that we brought to the table does a couple of things. So one, it tells you where your staff's sentiment is at that moment, and people experience ebbs and flows throughout their life cycle with us, right? So the first 3 months, maybe it's not a problem, but maybe at month 7 and 8, then people in this particular job class have a problem. And one of the things we saw highlighted was there's a spike of a likelihood to leave right between months 27 and 33. And so, they've been with us a little over 2 years. They're competent at their job. They're starting to become an expert. They're starting to train other people. And then right when they get those skills and they're really functioning and with all systems go, then they're like, oh, I'm mobile, I can go. And so that's a critical point right there, right? Month 26, 27, 28, that needs to be a key time in every person's life cycle that we need to work hard to retain them, because those are our ones that will hopefully transition into being the long-term team leaders, et cetera, to be able to power the organization. The ones that are coming in new with no experience with the organization, we still need them coming in, but the numbers tell us they're just not going to be there, right? 75% of them are going to be gone by the time they hit the 3-year mark. And so we need to do a good job of keeping them as we get towards that 3-year mark, because they're really starting to become productive at that point in time.
Absolutely. So what are some of the challenges that you see impacting broader adoption and growth of the use of tools like PrognostiCare?
So I think the biggest obstacle that's impacting every healthcare provider right now is just there's so many tools coming at them, and everyone has a new tool, new concept, new idea, and every organization prioritizes what makes sense to them in a different way. And so I think everyone has to go through that evaluation of what are the key imperatives that are going to drive the organization forward in a positive way. Is it knowing where my current staff is? Is it something completely unrelated? Do I need to buy a new machine? Do I need to do bed replacements? Are we doing capital expansion? Are we building a new wing on the facility? And so everyone's got to kind of prioritize what makes sense to them from a cost and allocation perspective, because there's no shortage of tools out there. Many of them are good. Some of them you scratch your head and you're like, what in the world does this do that adds value to anybody? But people are developing tools left and right out there. So sorting through is kind of I think a problem that many organizations are dealing with right now.
Absolutely. I totally agree. I think that's one of the things that I realized over 16 years ago when I was at Leading Age, leading the Center for Aging Services Technologies. And that's what I try to help aging service providers with is awareness about what's available out there. Number two, doing their own internal planning, right? Identifying the problem, because finding a solution without narrowly and squarely identifying what the problem is key to selecting the appropriate technology tool, right? Whether it's the appropriate solution, whether it's a technology tool or something else, right? So I totally agree. And the third thing is a lack of evidence or case studies that are targeted at the providers, and that's what we try to help technology companies working with providers to produce more of these case studies. Excellent. And what are some of the impacts and the metrics that you've seen from users of PrognostiCare in terms of improvement of their retention, reduction of turnover, and so on and so forth? And in which care settings or in which verticals have you seen some of these impacts?
Yeah, so right now, most of our clients are based in the acute setting that are using PrognostiCare at this particular moment in time. And there's a couple different components and ways that PrognostiCare can be used, right? One is for the current staff to gain a sentiment analysis of where they are and be able to know when you need to intervene at what stages to be able to keep the people that you have. So that's kind of one piece of it. And
kind of the Net Promoter Score.
Yep. So yeah, we use a Net Promoter Score overall, and we use 4 domains. So one is total reward. So what's finance and benefits look like. The second one is work-life balance. The third one is schedule, and the fourth one is family. And we've been able to boil all of the data points that we have kind of down into those 4 components, and then come up with a Net Promoter Score on top of that. And then if you've seen the movie Moneyball about the Oakland Athletics in the early 2000s. That's really what I would liken it to, is we can't say with 100% certainty who's going to stay and who's going to go. But what we can say is this person has a higher likelihood of staying.
Yeah.
And so if we can change the math just a little bit by choosing this person versus that person, we get a 17% higher likelihood of this person staying. Let's take that person. It's not 100% certain that they're going to stay, but I'm playing the math on it. And
probability game.
That's kind of
essentially.
Yeah. So that's kind of blending between the pre-hire and the current staff. So on a pre-hire basis, we're looking at all of the candidates and saying, okay, we have all of these candidates, and which one looks like the best fit based on the job classes that we have. And so that's where you get that, hey, you get the 17% higher likelihood of this person staying. You pick that person if they're the best candidate. No, nothing else is telling you that something else should be chosen. Then kind of a more creative way to use the solution is if you want to use it to target people to be able to take from your competitors. If you know who of your competitor staff is most likely to leave, then you can use it in the opposite way to go and poach whoever you may want. So let's just say, for arguments, that there's not enough doctors to go around in the country, right? That's an easy argument to say. We don't have enough doctors, and so highly
geriatricians, right?
Absolutely, yeah. There are very few geriatricians, and so let's say you need a geriatrician, and you don't have enough that you need in your organization. But you know who your competitors are. And so we would go out and we would sample the competitors and go, oh, well, Dr. Smith and Dr. Awad and Dr. Algie are the three that we have. Well, Dr. Smith is the most likely to be able to be open to a conversation right now. So instead of your recruiters going out and just blasting all of them, you can go target Dr. Smith right now and say, this is who we want to go spend our resources on, and put all of our wood behind this arrow so we can try to get the target that we need to bring them over. The two things, right? It strengthens you and it weakens the competition at the same time. And so that's, I think, one of the more creative ways to use this solution to be able to help refill your ranks with the right people, because recruiting resources are scarce as well.
Absolutely. And again, it shortens your recruitment cycle, right? Rather than look at a pool of 20, right? Most of whom may not be a good fit,
right.
So
great. Or they may not be open to the conversation right now.
Exactly.
But in 9 months from now, they might be. So let's keep them in the hopper. We'll look at them again, and maybe in 9 months a different one pops up, and that's the one we want to target at that point in time.
Right. That's the power of having continuously fresh data from all these sources to show you the indicators dynamically, right? Excellent.
Right.
So what are some of your growth goals and metrics that you would like to see improved? Are you thinking of expanding into other verticals, including long-term post-acute care, for example? And I'd love to hear your thoughts about that, because I honestly think that this is a tool that could be truly beneficial in the long-term post-acute care.
Yeah, I think the post-acute space is a very interesting space for us. It's not one that we have really opened up in a meaningful way, but appreciate you giving us this opportunity to chat with your audience, because I do think that there is a substantial opportunity, because the turnover is so high in post-acute. I think the last numbers I looked at, the post-acute turnover was worse than the acute turnover. And so it certainly has an opportunity. And I think the other thing that we're going to be doing this year is expanding beyond healthcare. And so as the algorithm works, whether you're a hospital, whether you're a SNF, whether you're a home care agency, or whether you're a manufacturer. And so I think this year we're going to also see expansion into one or two non-healthcare based verticals, and really prove out that this works for everybody on the planet, not just doctors and nurses and aides and therapists.
Excellent. What are some of the bigger or biggest challenges that you or your clients face that you believe technology, specifically AI-powered technology, could directly solve or significantly alleviate?
Yeah, there's so many problems in healthcare, right? It's an endless list of problems that need to be addressed, and automation through AI certainly presents a good opportunity. The key is, again, finding the right fit for the right setting and being sure that the solution that you're choosing works for in your setting, and that it truly solves a problem. Because I've sat through a number of presentations from other companies over the course of the past year, and at the end of the day, I take my founder hat off and I put my hospital CEO hat on, and I'm like this doesn't solve the problem, or this is not really, this isn't even a top 20 problem. This might be a top 200 problem, but it's just never going to raise to the level of I need to deal with this today. And I think that's kind of the problem, is there's so much. You've got to figure out how to prioritize. Just like you said, 15, 16 years ago, you were trying to help people figure out how to prioritize that. And I think it's worse now because it's so easy to create tools, and some vendors unfortunately don't know what their tool does. They don't know the value proposition or how it aligns with the strategic direction of the organization. And I think that's really critical, because if it's not value add, if it's not strategic for the organization, then it's just another widget, and it's not meaningful. It's got to bring value to the patient's lives, and it's got to bring value to the caregivers' lives.
Absolutely. Again, I think that one of the most disheartening things that I've seen among the entrepreneurs and technology companies is that they have a solution that's in search of a problem, as opposed to partnering with the actual providers of senior care or healthcare in general, to really deeply understand what their issues are and develop solutions in partnership with them. So co-develop solutions that work in the real world, and really address the root cause of the problems and the issues, as opposed to be addressing and a band-aid. Excellent. So what's the cost of inaction, right, that you see in senior living or in healthcare if they don't embrace these kinds of tools like PrognostiCare? And what do you foresee the biggest risk or missed opportunities for them in the next 3 to 5 years?
Yeah, I think that there's a quote by General Eric Shinseki that I think is super fitting to this point in history. And his quote was, "If you don't like change, you're going to like irrelevance even less." And I think that's the problem that people are struggling with right now, is there's so much that you have to do and that you could do, and balancing those have to do items with those could do items to figure out which one is accretive to the organization, improves the lives of my patients, improves the lives of my caregivers, creates the best workplace that we can, so we can grow the organization, continue to provide services to the community. And I think there's so much out there right now that you could do, that focusing in on finding a strategy that can be successful and getting that implemented, doing it very, very well, and not getting too many irons in the fire.
Yeah. To me, I think there's a common saying: the gap between the haves and the have-nots. I think the gap between those who use the appropriate AI and technology tools now and those that don't is going to increase. Mm-hmm. So if your turnover rate is high now and you're not using some of these tools, wait a few years and you'll see how it's going to get worse.
Yes, absolutely. I think so. I mean, people migrate to where the work is easiest for them to be able to do. And if you don't create an environment for those closest to the work to be able to improve it and to be as efficient and effective as they're possible, then they're going to find somewhere else to go. And, our data shows some of them are already looking before they even accept the job. They're looking for the next job. And even while they're saying yes to you, they're ready to say yes to somebody else. And, I think about my grandfather. He went to work for Century Insurance Company right out of college, and he retired from there 40 years later, and he never went anywhere else. And I don't think anybody graduating college today has any hope of working for the same company 40 years from now. That's just not the world that we're in right now today. And so how can you get, you're not going to get 40 years, but how can I get 4 or 5 good years out of somebody before they decide to move on, as opposed to I only got 4 months out of them?
Yeah, absolutely. So again, what opportunities do you see for technology and AI? What other opportunities, I mean?
What other opportunities?
You touched upon the automation, right, and the driving efficiencies.
Yeah, so there's so much back office work in healthcare that is not value added, but we have to do it. And so those things that are just kind of repetitive tasks that have to be done again and again, they're not necessarily single step items, they're multi-step items, but they've got to be done again and again and again in order to get bills out the door, to get supplies ordered in, to be able to get things transited around the facility to where they're supposed to go at. Those are going to be great for automation and allows the people to do the higher level work that needs to be done and providing the direct care. So I think a lot of that back office stuff is ripe for artificial intelligence. And then eventually, once we get robotics and AI successfully integrated at some point down the road, then allowing them to take a more proactive role in augmenting our caregiving staff. I think that'll be an exciting moment when we get there. We're still a ways off from that, but I think that's probably something that'll be really exciting down the road, as we have an aging workforce and not enough people to do the work coming down the pike.
Excellent. If you had an AI or a tech magic wand, what challenge would you like to point it at to solve for you? What would you like AI to solve for you?
Oh, that's a great one. Personally, as I think about the system holistically, it would be figuring out how to reestablish the relationship between the patient and the provider or the caregiver. With the way that our system is broken up right now, the patient is separate from the payer is separate from the provider. And in some cases, you've got an employer in there as well. And that really breaks the bond between the patient and the doctor in particular. And so I think if I could solve one problem, I think would be the most meaningful, that would be it.
Yeah, perfect. Excellent. What advice would you like to share with the audience? Whether it's technology developers, providers, or the sector in general?
Yeah, so I think for providers, it's finding the right partner that's solving the right problem that you have, and being sure that it's not a square peg in a round hole, and everything, if you're a hammer, everything looks like a nail. Well, that's not always the case, right? So finding the right thing that fits for you in your circumstance, in your environment, and being sure that it's solving a problem that the organization has that is hopefully a systemic issue. You want to solve those one-off problems, but solving those systemic issues is more meaningful and more impactful across the organization. And so that's what I would be looking at if I were on the provider's shoes at this point in time, is how do I solve a systemic problem? Absolutely.
Address them, nip them in the bud, right? Find them early and find the root causes, right? So that so like, for example, if it's a culture, right? A toxic work environment, for example, or lower wages or terrible benefits and so on and so forth. Excellent. So where can people learn more about you, about PrognostiCare?
Yeah, thanks for asking, Doc. So they can go to our website, www.PrognostiCare.org. Certainly, they can reach out to me directly. My email is todd.burch@PrognostiCare.org. And happy to connect with anyone that would like to chat more. And if they'd like to see any of the products or solutions, happy to share those. Or if they just want to learn more, we've got a couple of white papers out there talking about how things work. Maybe they can just gain some knowledge and improve some of their operations on their own. But appreciate you having me on to chat about it today.
Excellent. Thank you so much, Todd. It has been a great conversation, and really an important work, an important area to be actively involved in. Thank you everyone for watching. Please subscribe and follow on YouTube at All-One-AI Vantage and on LinkedIn. And until the next episode, have a wonderful day.